I invite you to pray in your faith tradition as I pray in mine if you're a praying person. 2 Timothy 1:7 says, "For God has not given us a spirit of fear and timidity, but of power, love, and self-control." If you would, please pray. Gracious God, you are the same God that brought unity in the wake of the needless killing of the 9 innocent people of Mother Emanuel Church. The same God that was with us in the 1,000-year flood. The same God that calmed the recent hurricanes. You are the same God that is with us today and the days to come. We put our faith and hope in you, for it's you that helps to bring out the best in humanity during times of trial. Grant us wisdom and give us your peace. Amen.
And Josie McDaniel Burkett, we thank you, and also we have Leslie Klippick with us. Thank you as well, ma'am. I have issued an executive order earlier today that does the following things, and these are not recommendations, these are orders, that all non-essential state employees shall stay home from work, and that will be decided by the supervisors. I direct the state agency heads to determine which employees are non-essential and see that they stay home from work. And this is effective tomorrow, Friday, March the 20th. If they're not essential, they should not come into the office. They can and should work at home. For our public universities, colleges, and technical colleges, each institution's president shall, and this is an order, shall, in their discretion, determine which employees are essential for the work of that school to maintain the students' ability to continue taking classes online this semester, so they can finish this semester online without interruption. Further, I've ordered that county and municipal governments are ordered to provide unlimited access to buildings or facilities in which state agencies are housed, and provide that access to the state agencies as they prescribe. Most of our state agencies, as you know, are providing critical services to the public during this state of emergency. Therefore, those agencies must remain open and responsive. And most of them are in county buildings. If the counties close, they must not disallow the function of that state agency that is also functioning in that same building. The approval period for unemployment benefits has been expedited. We're trying to speed it up as fast as we can. So far, we believe that those that are entitled to receive them can receive them through actions we've taken about a week quicker at a minimum, and we're working to reduce that. For employers, unemployment insurance benefits payments are suspended until June the 1st. Procurement regulations are temporarily suspended to allow state agencies, which must comply with those procurement regulations, are suspended to allow those state agencies to rapidly acquire the resources they need to combat the COVID-19 virus. That includes people, supplies, other things that typically take some time to receive. DHEC shall temporarily suspend the enforcement of Certificate of Need regulations. That is, temporarily suspend DHEC Certificate of Need regulations as necessary to expedite health care treatment for COVID-19. That includes patient rooms, beds, dormitories, and such things as that. As for law enforcement, SLED, the sheriff's, local law enforcement agencies are directed to vigorously enforce the laws as necessary to prevent looting, robbery, theft, acts of violence, and anything else associated with lawlessness during this time of emergency. We want the message to go out loud and clear to those who would attempt to take advantage of this situation, that lawlessness will not be tolerated. Our schools are closed, therefore the resource officers are available to work on this issue. School or court closings have also provided some officers that can be present. So I want to assure the people of the state that law enforcement is on the job and on duty, is strong or stronger than before to see to it that no one is harmed. None of our people are harmed by lawless behavior by others during this period. That is the extent of the executive order, the latest that I've issued just today. Now, I'm additionally asking for some things. I'm asking for all South Carolina hospitals and overnight medical facilities to immediately restrict visitations to patients. I'll say it again. Overnight facilities, medical facilities, hospitals, immediately, right now, restrict visitation to patients with the exception of end-of-life situations. Why is that? That is because visitors going in are asking for masks and gloves and gowns and other things, and what that does is take them away from the people that need them to treat this virus. I'm also asking South Carolinians to use common sense. I've asked this before. This is my final request of these requests today, to use common sense, treat their neighbors courteously and compassionately, and if you don't need to be in a public space, then stay home. We know this virus is spread by contact. It is spread by contact, touching things and people touching the things that you touched, or touching each other and having it get into your lungs, into your system. So if we are going to prevent this spread, we have to follow the rules that have been pronounced all over the country, which is washing your hands, don't touch your face, clean the counters, surfaces, and also, ladies and gentlemen, please don't hoard supplies. We have reports of stores running out of just the run-of-the-mill things, routine things. It's not necessary to hoard supplies. We have plenty of retailers as well as wholesalers going to see that we don't run out of these common everyday items that we need for our lives. So, and I'd also finally ask everyone to please follow the information that is given by official sources. There's a lot of misinformation going around and it's scaring people. It's not necessary to do that. Listen to the official sources like this one. We're attempting to answer as many questions as we can. Earlier today, I was on a conference call with the Vice President and the President himself, as well as a number of the officials in Washington, and they have assured us that whatever we need, whatever all the states, I think all 50 governors were on the conference call, that the federal government is moving heaven and earth to see to it that the supplies and things that we need will be provided. And this is going to include things across the board, from unemployment to medical supplies, but we have to be calm. We need to not lose our heads. We need to be courteous to our neighbors and act like South Carolinians. We've been through these things before. We'll be going through them again. We have not seen the end of this yet, but everything that can be done is being activated and implemented as precisely and as quickly as is necessary, and we are staying ahead of it, but we need the cooperation of every single citizen. If you don't need to go out, then don't. Wash your hands. When you touch something and you touch your face, you're in danger of picking up that virus. It's so hard just to follow the simple rules, but the simple rules are the ones that are going to keep us all from getting sick. And by all means, if you're sick, stay home. Call the doctor, and we're making arrangements more and more to have the testing facilities open. We hope at no charge for everyone that needs to have that test. Dr. Bell.
Thank you, Governor, and good afternoon. As of today, South Carolina has confirmed cases of COVID-19 infection in 17 counties across our state. The information about the counties that are for which cases are reported will be posted on our website. To date, DHEC has received 81 confirmed cases from our public health laboratory and private laboratories. And our public health laboratory has performed 906 tests, of which 833 have been negative. So less than 10% of the tests run are positive. DHEC will continue to provide the number of positive cases and the county of residence. As cases increase, we will prioritize identifying the close contacts who are at high risk of infection from exposure and who are most likely to have serious illness. This includes our nursing homes and assisted living facilities, as well as other vulnerable populations with unique circumstances. Our top priorities remain preventing the spread of disease and protecting the public health. This includes working to control spread and sharing measures that best protect our neighbors, our friends, and our family members. Be assured that we are working hard to take steps aimed at keeping all of our residents safe. According to the CDC, this is a historic, unprecedented outbreak, the likes of which have not been seen since the influenza pandemic of 1918. This will likely be an extended response, and we want people to be prepared for more cases to occur and to continue to listen to and to follow recommendations from public health officials. If people don't follow current recommendations for social distancing and avoiding crowds, we may see a doubling of the rate of cases similar to what we've seen in other states. We expect a dramatic increase in case counts from one day to the next, and the public should be prepared for that. This is a challenging time for most. It is taxing on members of our workforce who are trying to respond to this ongoing public health event, while also maintaining critical services and infrastructure. It is taxing on our healthcare providers who are providing essential care, and it is taxing on our community as a whole, many of whom are already feeling the significant impact of this event. We must continue to do all that we can to protect our critical workforce that is working 24/7 to ensure the effectiveness of our state's infrastructure, healthcare, and disease control activities. Please be mindful that during this time, the resources are limited, and it is important that we don't unnecessarily use resources that we must all share, especially from those who need the most, like our state's most vulnerable populations. Supplies to collect samples and run tests are limited. We do not recommend that everyone who is ill get a test to see if they have COVID-19 infection. If disease activity increases significantly, we will advise people to stay home, get better, and seek medical care if symptoms are worsening. This will allow our healthcare system and other healthcare providers to give care to those who are most in need and who are seriously ill. We tend to spend most of our time interacting with those who live close to us. That understandably raises concern about what level of caution we should take and what necessary activities we can participate in. And in that light, we have received several questions about concerns related to shopping at grocery stores and other public settings. You should know that the transmission of the illness requires significant close contact with an individual who is ill. Brief contact in public settings, like the grocery store, is not considered a high-risk exposure for all those who are present in that setting. We don't want to cause unnecessary alarm or demand on our healthcare systems by making notifications of these public places where cases have been. DHEC would advise no additional measures for anyone who's been present in general in one of these public settings, beyond what we have been recommending for communities in general. Everyone should monitor for symptoms, practice social distancing, avoid touching frequently touched surfaces like doorknobs and handrails, and regularly wash your hands. And always, after being in a public place, wash your hands. Realizing that spread is occurring, when you hear about the first cases or growing cases in your community, we encourage the public to focus on things that each of us can do to limit the spread of illness. This includes washing your hands and covering your mouth when you cough. Don't overreact as cases increase. Individuals with signs of illness must stay home and not attend public gatherings. The people who are at greatest risk are those who are older and have serious chronic medical conditions like heart disease, diabetes, or lung disease. You may be charged with helping to take care of a family member, friend, or neighbor who is at greater risk of becoming ill. So follow information provided by the CDC and by DHEC for safely providing care in the home. Please be thoughtful of how others are feeling during this time and reach out to them regularly to let them know that you and our state are here for them. This is an emerging and rapidly evolving situation, and DHEC will provide updated information as it becomes available. We will continue to provide updates on our webpage at cdc.gov/COVID-19. Thank you.
Thank you, Dr. Bell. Are there any questions? Ms. Adcox?
Yeah. So starting with the testing samples, or what's needed to actually take the test, where are the supplies limited? Where are the shortages exactly?
Doctor? Dr. Toomey?
So the question was about testing supplies. They're limited across the state. Some places have more than others. We continue to work with the hospitals and doctors' offices with those supplies. As you can see from the numbers that DHEC has processed in our lab, the numbers are dramatically increasing, and it's a challenge. We can do as many tests in a day as we're getting. We're not limited by our volume. We're limited by the supplies, and we're working with the suppliers, the CDC, to get both the swabs, the kits, and the reagents for our machines that run the tests.
So from what I
And
understand,
those, Ms. Adcox, that is one of the questions that came up on the conference call with the president and the vice president, and steps are being taken to be sure that there's a flow of all those supplies.
on that note, do we know how much we're getting from the federal stockpile at this point?
We are receiving and have received our allocation of the supplies. We are breaking them down by the pallets that received for an individual pallet for each county to be distributed in the upcoming days. We have a actual breakdown of the number of N95 respirators, the number of masks, the number of face shields. I don't have that sheet with me, but we will make that available on our website.
So if people already weren't getting tested before they got screened, I mean, what's the disconnect now? Why are we all of a sudden having a shortage?
I'm sorry, if people, please repeat the question.
If people weren't getting tested without being screened by something like MUSC or something like that, I mean, has there been screening for people who didn't have symptoms and just wanted it? I thought you guys had been discouraging that since day one here.
We continue to discourage testing of individuals who don't have symptoms. And the telemedicine services are screening people for signs and symptoms of illness, and they're being referred to various to drive-through testing or other healthcare facilities. And we're encouraging healthcare providers to only test those, recommend testing for those who meet those clinical criteria.
Right, so if they are being screened like that, have we just seen that many cases of people thinking that they have the virus? Is that what's going on here?
So I'm trying to understand your question, the difference between screening and testing.
No. My question is, people are being screened, and when they're screened, that's when they're recommended to be tested. So if that's already happening, where people have the idea that they have the virus and need to be tested to confirm it, I'm just wondering how now all of a sudden we're starting to have a lower supply than it seemed like we had a few days ago.
As we have communicated and the issue has ramped up in everybody's awareness, and as we have pushed out, like MUSC.care, the accessibility for people to be screened, we are seeing an increase in those that are being identified to be tested. So it's logical, and as we screen more people or test more people, we'll see more tests and we'll see more positives. But the good news is that with the enhanced services access for screenings, we're screening more and they're being identified, but we're still seeing only about 10% of those that are tested being positive. But we've seen a dramatic increase in the number of tests being performed, and that's just on our lab. And now MUSC, LabCorp, and Quest Diagnostics are doing them as well. So a greater population is being screened and tested.
And on that note, since you're not getting the negative numbers from the private labs, are you concerned about?
We
getting
do get the
blind spots?
negative, we get the positive numbers from the private labs.
Right, but you don't get the negatives. So is there any concern that there's some blind spots in the state surveillance on that?
I'm gonna,
No, getting negative results gives us an indication of the number of people being sampled. So it is the positive results that we rely on, and when we look at the proportion of positives from all those tested, roughly 10% from the DHEC laboratory, because we get positives and negatives, that tells us that there is adequate sampling when we have such a low percentage of positives.
Dr. Bell, why not give more information about the patients, their age, their gender, maybe specific towns, so people have an idea of where this is spreading?
So we are reporting the information by county, and we are reporting information by particular settings where there's a significant risk. For example, in a nursing home setting. As I mentioned earlier, in general public places where we do not consider individuals who have been in those public places to be at increased risk, we are focusing on the close contacts. And as the cases of it increase, we are prioritizing our efforts on best protecting the public health and limiting the spread of the virus. So when a positive case is known, we work to identify the close contacts and we announce those positive cases. And we will always provide the information that helps South Carolinians remain informed about the information that they need to act on. However, we are obligated and we're required to protect every individual's private health information. And hospitals and healthcare facilities have similar restrictions that protect health. So reporting on things like gender do not have any implications for public health. And we separate the difference between information that is of public health interest and information that is of public interest. So we act on information that has implications for protecting the public's health.
Dr. Bell, the first COVID-19 related death in South Carolina, I believe it was at a skilled nursing facility in Lexington, if I'm correct. I was curious if there is any other COVID-related transmissions connected to that exact skilled nursing facility that you guys are tracking.
And we have identified other cases in that facility that have been in close contact with the first identified case. And we are working with the healthcare facility to provide infection control recommendations. We are taking measures to isolate individuals who have been exposed, healthcare workers, and other patients in the facility, and also working with the hospital to which those cases were transferred.
Is that new Lexington County case connected to that nursing home facility?
So when you say the new Lexington
The one
County
that was listed
case,
today.
and we are not reporting on individual information, but we are working with the healthcare facilities to do contact investigations around cases to protect those at highest risk of exposure.
Governor and Superintendent, at this point, do you think that the school closures and in-dining services will be canceled beyond March 31st?
I think we're looking at that very closely. Obviously, we will probably need to do that. We'll make that decision soon. There are 2 districts that have announced that they're going to move some of their professional development days for teachers and their spring vacation forward. So we have 2 districts, Charleston and Anderson 5. I've asked the other districts if they will wait so that we can make a unified announcement. I anticipate that that could come in the next few days. But as of now, it's March 31st, but we are working with our instructors, working with our superintendents daily, and making preparations for a longer time.
Or all the districts now have the distribution of food? And
Yes, it's going, if there's good news, and we need some good news, we're very, very pleased with the way our food distribution is working. I've got pictures, I'm sure you're seeing it, of students receiving their meals. There are tens of thousands of students who are being served meals, and students who are working, parents are coming home to help their children. But I would say to parents, we understand, particularly in our healthcare workers, how difficult this is. Do the best you can. Do the best you can with your students, and don't feel that you have to put undue stress on yourself or your children to get the materials in. We're going to be very, very understanding of that, and we realize that we may be in this for the long haul. So everyone relax, and I can promise you, your educators in your school and certainly at the Department of Education, we're going to do everything we possibly can to give the flexibility to our students. One of the priorities for us will be our senior students, and making sure that they will be able to get the credit and the new learning that they need in order to be able to graduate and to take the tests that they need, not the end of the year tests, but those tests like AP, SAT. We're going to be working very closely with those companies to ensure that our high school seniors will be able to get that work. We don't have all of those details right now, but we are certainly working on that and hope to announce something next week.
Well, in Kansas, as you know, is just quit for the entire rest of the school year.
Yes.
Is that possibility being discussed here?
We've not gotten to that point yet. I think we're taking an approach of looking at it appropriately as the weeks go by, and we have not made that decision at this point, but we'll try and make the appropriate decision as we move along through this crisis.
Dr. Bell, I have a follow-up question about the skilled nursing facility. How many hospital cases are you tracking right now, and how large of a facility is it? Like, how many, if you're able to tell us, how many people are living there?
It's a very large nursing home facility. I believe it's the largest in the state, and I don't have the bed count. And the total number of individuals being tracked and isolated, I also don't have that exact figure.
And this might be a question for the governor. We've seen a lot of these cases in Kershaw County, it seems like. Any recommendations for a shelter in place right now for that county, since we have seen a lot of them there?
The recommendations for all citizens are the same at this point. I think most are aware that the Kershaw County is leading in the number of cases, but that just emphasizes how we must be very careful and follow the rules that have been discussed every day among all our citizens. We have to be careful.
Governor, your executive order obviously affects state employees. What's your recommendation for city and county employees in terms of non-essential personnel?
I think most of the city and counties are doing the same thing. A lot of them have announced it, but I think they should do the same thing. I think it ought to be a rule. If it's a non-essential employee, you ought to stay home or work from home. There are a lot of ways that you can work from home, and this is a good opportunity to explore that and do it to the maximum extent. And that automatically provides the social distancing that we're talking about and the lack of contact with other people, touching things that others have touched and then touching your face. Back to an earlier question, there are certain laws that prohibit the dissemination of certain health information. It's why the DHEC is restrained in answering some of the questions that have been presented during these conferences.
What are your thoughts on possibly closing our beaches and any tourist advisories?
Well, they've done that I think in Daytona or some places. We're watching that carefully. Nothing is off the table. We don't want to go too far too soon, but we are intent on staying ahead of this virus. So anything that we know will work, that is necessary to get done, we're trying to do it sooner and not later. Yes, sir. Go to that gentleman.
Are there any guidelines for hair salons or barber shops where you have very close contact with customers? Any guidelines for them shutting down, or how are we approaching that?
I'll ask one of these from DHEC to answer that question, but I know that a lot of them, as well as doctors' offices, they're taking all the magazines out and those sorts of things that people usually touch while they're in those facilities. Dr. Bell.
No specific guidelines for the types of businesses that you mentioned, hair salons and barber shops, but there are guidelines for businesses in general, and they're essentially the same, that they should practice social distancing and consider if they're providing an essential service.
Dr. Bell, a Beaufort city official this morning referenced a person who had a heart attack and died who had previously tested positive for the virus. Is DHEC investigating that as a possible connection to this?
I have not heard that.
We're being told that some hospitals don't plan to stop those elective procedures that you previously said should stop. Are you citing anyone, any hospital, and what happens if they don't?
Well, this is a part of the executive order today, and we expect everyone to comply.
Governor, for the folks who are going to be out of work and are receiving SNAP benefits, is there anything that you heard from the federal government or that we're doing here in South Carolina to try to make sure that they're able to
Yes,
still get that?
the Commissioner of Agriculture, Hugh Weathers, and his team are deeply involved in that, and also we've received assurances from officials in Washington that those measures are being taken right now to address that.
What about for industries that can't work from home, like people in the service industries, restaurants where they're having to let waitresses and folks like that go? I mean, are there going to be any benefits for them that they can
Yes,
take
there
advantage
are
of?
unemployment benefits right now for them, and there will be more coming. Additional steps are being taken, as I said, in Washington to address that very thing.
And speaking of that, you said they'll get it a week quicker. Say, for example, if someone were to file today, when might they get it? A week quicker than what? essentially?
So under the rule, prior to the executive order, it took about 2 weeks with average employer response as to the reason for the termination or separation for the first benefit check to be paid. With the executive order, it will take 1 week. If it is an employer-filed claim, which many employers do and can do, it will be approximately 3 days before the employee gets his first check.
Is the website capable of handling everyone who's filing? Has it gone down yet? Do you expect it to go down?
Well, we had problems with it yesterday. We're completely computerized here and have been for 3 years. We had a number of claims coming in like we have never experienced before with the computer. We added capacity to it about midday, and it has been running fine ever since.
Any possibility we might raise the cap on what you can weekly receive? Can we
Right.
do that by executive order? They're capped at what, $300 or something like that?
That's statutory.
Governor, this is a question for the governor. We've been hearing from some employees of some large manufacturers across the state who, are keeping them working, that they're concerned about it, working very closely with other people. Do you have any recommendations for them? I know legally there's nothing you can do for closing these facilities down, but is there a hotline, a number they can reach out to if they're concerned about their working environment?
Again, the guidelines have been posted in the various websites. The manufacturers, many of them are in very big plants where the workers are not too close together. But we're asking everybody to follow the rules, follow the recommendations, just like with the hospitals. Don't allow the visitation unless it's end of life, because that uses up all the gowns and masks that the visitors want to have. But this is something that is very, very serious. And we would say anyone that in any business that can work from home, go ahead, and the supervisors, employees ought to let them work from home. In these other big plants where that's not possible, then they should take steps to implement the other measures that have been recommended to see that their workers and employees are safe.
Dr. Bell, there are 2,000 dentists in the state, and when you go to a dentist, you're going to be pretty close to your dentist. There are dental associations recommending dentists postpone elective procedures, only do emergency and urgent dental work. Is that something that could be mandatory in South Carolina?
I can't answer if that's mandatory for dental practices to close to elective procedures, to close to.
Well, we're asking any sort of elective procedures, that certainly in hospitals, to allow for the possible influx of patients needing critical care. I would recommend that if something doesn't need to be done, that it be postponed if there's any danger. But again, following the procedures that have been set out in virtually every communication by DHEC and others, if those are followed, then people will be safe. It's when they lapse or they don't realize that they're touching something or doing something that can provide the contact to spread the disease that we have problems.
Talking further about hospitals, can you speak a little bit? I mean, are they going to be getting any of the masks and things that are going to be made
Yes.
available from the federal stockpiles? And is it
Yes.
kind of a ballpark for that?
Yes, the answer to that is yes, and also, as I mentioned with the conference this morning with the president, the vice president, and Dr. Burke and the others as well, the measures are being taken, strenuous, strong measures, an effort of being taken to be sure that all of those kinds of supplies and things, personal protection equipment is what they refer to it as, are being produced and disseminated in great quantities.
Would that be just to hospitals, or would it also be for EMS workers showing up and having to put their...
To everybody. We're asking for and receiving great flexibility.
And as these cases do progress, are there any expectation of bringing doctors from surrounding counties or states or anything of that nature?
Every state's got their own problems with this one. This is, when we have hurricanes, of course, we have people from other states coming in to help. But this is like a hurricane in every state. In some states, they've never seen such a thing as this before. So this is one where all the assets are being activated. As you know, our National Guard is entering into making plans with hospitals to perhaps set up facilities where people that are not in critical condition can stay outside of the hospital. We're taking all of those kinds of steps.
Director Elsie, I actually have a couple more questions for you, if that's okay.
Sorry, wrong director.
Do we know how much we're going to get from the federal government for health and unemployment taxes? And do we have to change any of our policies to be able to get it?
We know that we will get the standard allocation coming to us, is what we understand. There's nothing final. Of the $1 billion, well, of the first $500 million. The second $500 million, if we hit the unemployment rate, then we will get the second part of it. The exact number, we don't know, and I don't think DOL knows at this time.
Dr. Bell, just to clarify how you're monitoring these cases, I know we say there's one in Greenville County, one in Spartanburg County. Does that mean they're from this county and living there, or is that where they're diagnosed at? How does that work?
Cases are reported by their county of residence.
Dr. Bell, you said previously you don't, once someone's diagnosed, you don't follow their track through the health system. I guess, how do we know we're flattening the curve and how well, if they're recovering?
So what we're focusing on is the occurrence of new cases. So we're very concerned about the individual's outcomes on a personal basis, but and we hope that they all fare well. But the health department's responsibility is to conduct disease surveillance for new cases. We don't provide care. And so our focus is on identifying new cases, and that's what tells us about disease transmission in the community. Individuals may have a short or a prolonged course of recovery, but that doesn't have implications for new cases that are identified in a population. Our focus is on identifying new cases and preventing spread from those, not on the outcomes of individuals who have already been identified, although we're very much concerned about that as individuals, but the agency's responsibility is disease surveillance.
So what should we look for? If everything's going well, what should we be looking for?
We should be looking for new cases. And so that's why we ask individuals in the community to be aware of the symptoms that can present and to seek health care so that they can be evaluated and tested. So we expect to see cases increase as we test more and more individuals, and that's an indication of spread in the community, and that's what we should look for.
Recognizing that you're not giving specific demographics, how young are our patients in South Carolina? What are we seeing folks in our 20s, 30s, teens?
So because even though we're seeing cases increase here, the number of cases is actually relatively low compared to other settings, and so it's more useful to use these larger case studies. And what we know is that actually the CDC just published a paper on this, I believe yesterday, that tells us that approximately a third of the cases are elderly individuals, 45% of hospitalizations are in individuals who are 65 years or older. The majority of deaths are in those who are in the elderly. Nationwide, there have been no reports of individuals who are 19 years of age or younger who have died or who have been admitted to an ICU. And so when we look at our South Carolina cases, because we have a relatively smaller sample size, we can expect that our rates of hospitalizations will be similar to what we're seeing in jurisdictions that have a much larger caseload, and that the profile of cases, the proportion being expectedly higher in the elderly, that's what's being seen elsewhere in the United States and also internationally. So we use that data to anticipate what to expect here and who is most at risk.
Governor, the Spartanburg County Sheriff just confirmed they had a false case in Spartanburg where someone forged a doctor's note and told their place of employee they had COVID-19.
I can't hear you. Say that again, please.
We just confirmed with Spartanburg County Sheriff that there was a case there where someone forged a doctor's note and told his place of employee that he had COVID-19. Have you heard about this happening in other counties, and what's your reaction to that?
No, I have not heard about it, but that's exactly the kind of thing that we don't want to happen.
Where have you seen the community spread?
Beg pardon?
Where have you seen the community spread?
You want to talk or do you want?
Where have we seen community spread? We are seeing spread primarily in Kershaw County. It's approximately 50% of the cases in South Carolina are in Kershaw County. And then we've also seen transmission in the nursing home facility that was in Lexington that was mentioned earlier.
Dr. Bell, the President mentioned today that the FDA approved an anti-malaria drug to test as a coronavirus treatment. Have you heard anything about this, or?
There are studies being conducted of certain drugs that are potentially effective against this virus. Any specific mention of this malaria drug, I'm not familiar with that.
Governor, just to clarify,
Sure.
are all universities moving forward online for the rest of the semester?
Yes.
So,
That's what we are asking them to do and requiring them to determine which employees can work at distance, work at home, and to use their discretion in having those do that and work from home.
Private colleges?
Beg your pardon?
Public and private?
My authority at this point is on the public colleges, but we presume that the lessons and the ideas will be adopted by others as well. And to clarify, or to add to a previous a point made, by removing the regulations, a number of the regulations that we have in the state, and allowing for the collaboration and cooperation among the different agencies in ways that aren't usually done for this period of time, we are bringing the full strength, even an accelerated strength of the talent that we have in the state, and we have plenty of it onto this crisis.
Governor, we just got an interesting question. You're restricting visitation in hospitals. Does that apply to a woman that might be giving birth and their family or husband being there, being present for the childbirth?
There can be exceptions, but those can be addressed. But as the rule, the order is, unless it's end of life, we don't want visitors. Don't want people visiting that may want to use because it may help, it may contribute to the spread, but also it could use up the time and talent as well as the supplies of those hospitals.
Governor, are there current talks on a national level to ensure that the patients receive low-cost or free treatments?
Say that again, please.
Are there current talks to ensure that the patients receive a low-cost or free treatment for the COVID-19?
As far as the testing is concerned, that has been discussed and decided. The insurance companies in this state, as well as the federal authorities, are providing funds and exceptions and allowances to see that the tests are being free of charge to those that are taking the test. And then you have the questions of the test and the examination leading up to the test, and that is something that we are confident that there will be arrangements made where that will be free of charge as well.
Governor, I have one last question. We've been talking to some speech therapists from Title I schools who are worried they can't teleteach because it requires a separate license to do so. Is that some kind of regulation that could be lifted by you at this time, or something you've talked about?
I will certainly look at that, and if necessary, we can make arrangements for instruction to happen. So thank you for that. I'll be glad to look at that.
And do we
See,
know-
on everything we're trying to do, we always have to add a little dose of common sense.
Do we know anything about pregnant women? Is there any threat to the babies in the womb of them transmitting that disease or getting that coronavirus as well? Or?
Doctor?
Because this is a new virus and we've had really only a matter of a few weeks to study all possible complications, so we don't have any information about whether or not the virus can be transmitted to an infant in the womb, or if pregnant women are experiencing more severe complications. But for pregnant women in general, they may do poorly when they have infections during pregnancy. So we ask them to take special measures to prevent exposure.
Final question. Ms. Adcox.
Can you explain again exactly what you want public and private or public colleges to do? Apparently USC announced as your press conference started that they were going online.
Yes. We want them to allow the non-essential employees to not come into work. And we also, and we want them, of course, what they're making plans to do distance learning, e-learning, so that they will be able to continue the classes online so that all the students will be able to graduate. We'll get the courses, the course credits that they need.
Governor, I just have one last question. For those that may be having some difficulty with mortgages, are there any relief for them as well, or what's the plan for those individuals?
A lot of that would involve federal regulations I'm not familiar with. I know that subject has been discussed, but I don't know what decisions have been made about that. Okay. Thank you very much, and we will do our best to keep you informed.